Assalamualaikum. I'm Dr. Sophia Akhtar, and today we are going to discuss about prescription writing.
Here is a scenario which shows a 30-year-old male patient who is suffering from unilateral throbbing headache for the last 6 months. He was also suffering from blurring of vision. He was advised NSAIDs and rest, but the symptoms remain same. What should be appropriate treatment plan? By looking at this scenario, we can see that the patient has unilateral throbbing headache and he's also suffering from blurring of vision. So we reach to a diagnosis that he's having migraine headaches. So step one is to make a diagnosis, which in this case is migraine. In step two, we look at the therapeutic objectives. In migraine, the different therapeutic objectives are to reduce the frequency of acute episodes of pain and then to give the treatment for the prophylaxis of migraine. In step three, we'll look at different groups which are available for the treatment of migraine. Uh, First of all, NSAIDs, then 5-HT1 receptor agonists, ergot alkaloids, tricyclic antidepressants, beta blockers, and calcium channel blockers. Among these, NSAIDs, 5-HT1 agonists, ergot alkaloids, these three are used for treatment of acute episodes of migraine, while tricyclic antidepressant, beta blockers, and calcium channel blockers, they are used for the prophylaxis. If we look at 5-HT1 agonist, these are the triptans, and these you know that they cause vasoconstriction and they also modulate the neurotransmitter release. In ergot alkaloids, ergotamine is used, which is a partial agonist at 5-HT receptor and also at alpha receptor, especially in blood vessels. For the prophylactic tricyclic antidepressant such as amitriptyline is used, and among beta blockers, propranolol and nadolol are used, and in calcium channel blockers, verapamil is used. Step 4 is to compare different groups. In this scenario, 5-HT agonists, NSAIDs, ergot alkaloids, tricyclic antidepressant, and beta blockers are available. So, if we compare all these drugs, we can see that the 5-HT1 agonists they are most effective and they are safe as compared to other drugs. While NSAIDs are effective and safe, but they are contraindicated in renal failure and in chronic liver disease. Ergot alkaloids are effective, but they are expensive. And tricyclic antidepressants are also expensive. And beta blockers are effective, but they are contraindicated in different diseases. If we compare 5-HT agonists, we see that two drugs which are available are somatriptan and zolmitriptan. Among these, both of them are effective, they are safe, they are suitable, but somatriptan is cheaper as compared to zolmitriptan. So, by comparing different groups and different drugs, we reach to the drug of choice in migraine, which is somatriptan. Now we'll see how to write a prescription of migraine. In prescription, as we know that on the right hand side we write the doctor's name and his degree. Then on the left side we write patient's name, age, sex, and then date. Then the presenting complaint, which in this case is unilateral throbbing headache for the last 6 months. Then by seeing this presenting complaint, we make a diagnosis of migraine headaches. Then RX, which is to take. Includes tablets somatriptan 25 milligram per oral OD for 1 month. And in the end, we on the right side we give the doctor's signature along with its PMDC number is mentioned. So this is how we write the prescription of migraine headaches. Thank you.